Although most people think of heart disease as a man's disease, it is the #1 killer of women in the United States. According to the National Institute of Health, 2/3 of all women who experience a heart attack fail to fully recover. Dr. Gary Allen, Medical Director for Cardiothoracic Surgery at Florida Hospital Waterman, explains why it's especially valuable for women to understand the importance of prevention and the warning signs of heart disease.
The reality is, heart disease is the #1 killer in women, and it's the #1 killer by a long ways, meaning that the next 3 leading killers, things like cancer, infection, trauma, if you add all of those up, heart disease is still the #1 killer in women. The challenge, though, with women in heart disease is they typically don't manifest the same type of symptoms that men do. Either through personal experience, our education, or things we see or read on television. You know, there's the chest pain that somebody's holding onto their chest and they're having this terrible pain. But that only occurs about half the time, and in women even less so. So women tend to have atypical presentation. They have fatigue, sometimes sadness or depression. Sometimes they don't have any symptoms until the day they have a major heart attack. So interestingly, even though women have a longer life expectancy than men, women do less well with coronary disease. Women tend to present about 2 to 3 years later. So they've been holding on to these symptoms for a lot longer, not ever thinking, that it was heart disease. And then their results tend to be not as good, whether that's stenting or bypass surgery. So I think public education, is certainly probably the most important part on how we manage those patients, with symptoms. I think we have to be what I call intellectually honest. You look in the mirror, you notice you're a little older than you were. You step on a scale, you realize you're heavier than you were. Hopefully we become honest in knowing our numbers. And by that I mean knowing things like our blood pressure, our blood sugars, our cholesterol. And pretty much anyone after the age of 40 needs to be into some type of what I would call maintenance program. So they need to see their regular primary care doctor, even if they have no symptoms at all, to start to do what we call risk stratification. If you've had a lot of family members, have early manifestations of cardiac disease, if you're overweight and you have high blood pressure and so forth, how we would take care of those patients is different than the 40-year-old who's at a perfect body weight, has no medical history, and runs 20 miles a week.
You'll find more information about Dr. Allen, the staff, and procedures offered at the Waterman Heart Center when you click a Woman's Risk story link on our homepage, yourhometownhealth.com.